When you have mild burns, you can utilize natural burn cures as a first treatment. Burns can occur as a result of hot oil splashes, exposure to motorbike exhaust, or excessive sun exposure. Burns are classified into 3 levels based on their severity: mild, moderate, and severe. The type of therapy will be determined by the severity of the burn. Second and third degree burns should be treated by a doctor at the nearest hospital as soon as possible. However, if the burned area is extensive enough, first degree burns may require medical attention. Minor burns treatment. First degree burns or small burns can be treated with the following natural burn cures because they only cause modest damage to the outer skin or epidermis. Cool water but not ice water. When your skin is burned, the first thing you should do is wash it with cool water for 10 to 20 minutes, or until the stinging feeling subsides. You can use a small towel or cloth covered in ice to apply a cold compress to the burn for 5 to 15 minutes in addition to cleaning it with cool water. It's important to remember that compressing your skin with cold water too frequently will aggravate inflammation. Aloe vera. This single plant contains anti-inflammatory, antioxidant, antibacterial, and wound healing properties, as well as the ability to moisturize the skin. Aloe vera gels or ointments containing aloe vera extract have even been shown to be useful in the treatment of burns in numerous investigations. As a result, it's not surprising that aloe vera is frequently utilized as a natural burn treatment. It is recommended that real aloe vera gel be applied directly to the injured area to heal burns. Choose artificial aloe vera products with a high proportion of aloe vera content if you use them. Also, stay away from aloe vera products with additives like colors and scents, as they might irritate and hurt your skin. Honey. Honey is said to be a natural burn cure because of its anti-inflammatory, antibacterial, and antifungal properties. Honey has been shown in a study to be effective in treating small burns and speeding up the healing process. In addition to the natural burn cures listed above, pharmaceuticals such as antibiotic ointment can be used to treat mild burns. Apply the ointment to the burned skin and cover it with sterile gauze, or as advised by a doctor. If necessary, pain medicines such as paracetamol, which are available over the counter at drugstores or pharmacies, can be used to treat discomfort and soreness on the skin caused by mild burns. Things to avoid in treating burns. There is one thing you must understand first. If it hasn't been scientifically verified, don't accept what people say about burns healing with this or that. If you put something to a burn carelessly, instead of mending it, it will aggravate it. The following are some important taboos to be aware of when treating burns. Do not use toothpaste on burned skin since it will aggravate it and create infection. Coconut oil, olive oil, and cooking oil should not be used. The oil holds on to the heat and keeps the skin warm. Egg whites should not be used because they can lead to bacterial infections and allergic responses. Avoid breaking the blistered and inflamed skin, as this can lead to infection. Applying butter or margarine to a burn might induce infection. Do not remove sticky clothing. If clothing becomes caught on burned flesh, do not remove it until you consult a doctor. Avoid putting ice directly on burnt skin. This will simply aggravate the wound. Stay out of the sun. The skin that has been burned will be extremely sensitive to sunlight. As a result, avoid exposing the burn to direct sunlight. Minor burn cures can be used to treat minor burns at home. If the burn does not heal within a few weeks, large blisters emerge on the skin, fluid comes out of the lesion, or you have signs of infection such as fever or a terrible odor in the wound, call your doctor right away. Thank you for watching and please subscribe for our next video.